All right, so today we're going to touch upon a pretty big topic, but it's something I've been thinking about for a very long time, for decades, and that is why holistic medicine is superior to Western or conventional medicine. Now, before some of the haters and the trolls come out, I want you to realize I've got a background in both. Okay, so went to medical school, realized what was going on early. I enjoyed a lot of aspects of medical school, and I have a lot of respect for certain specialties and for certain doctors. And I will get into that in a different video. But for this, I just want to distill things down into three different points in order to encapsulate some of these concepts that I've experienced, seen, and finally been able to really sort of talk about over the years. So again, my background, Western conventional medicine, been board certified, but I've also formally studied traditional Chinese medicine, and I've also gone further and gone into more energy, vibration, frequency, have learned about other different theories. I haven't just stopped with conventional medicine. I'm a lifelong learner, and it's important for me as someone who wants the truth to try to find the best for myself, for my family, for my patients. So, first, if you are somewhere, and let's say you're coming home, and you see some smoke coming out of your garage, are you going to deal with that smoke right away? Or are you going to just push that aside, wait a couple days, maybe wait a week, if you can, and wait to deal with it until it's a raging fire? So in the comments, please put whether you would deal with it when it's smoke or whether there's fire. Use a fire emoji. I'm betting you would deal with it when it's smoke. That's how I feel too. And why would you wait when someone is experiencing something? Why would you wait until it becomes more and more of a problem to deal with it? So when I was in medical school, I looked different. Right now, you see I've got this shaved head, but I had long dreads. Well, they were kind of, and then they got longer. But I had dreads in med school, and this was in the 90s. And so a lot of my attendings were white, and I did a lot of my rotations in the county hospital. So I was seeing just all sorts of folks, but particularly a lot of Spanish-speaking folks, a lot of black folks. So the attending would leave the room, and it would be just me and the patient. The patient would look around, realize the attending's gone now, so they would speak freely, and they would ask me, they'd say, hey, I've been telling him, usually it's a man, I've been telling him, that I've been having these issues, and he just keeps telling me to come back when it's worse, when they can do something. And then they would ask, there's got to be something like that I could do. There's got to be something that I could do now instead of waiting until I either need the surgery or I need this intervention, or there's going to be another medication that gets added on. Now, I'm in my early 20s. I'm in medical school. I'm trying to learn the medical school stuff, so I don't know anything else, right? I haven't done anything else. I've just been in school the whole time, working summer jobs. So I've got a little bit of experience just from my life experience, but I don't really have any other thing to compare this to. But I would take a mental note, and I would talk with them and say, hey, I don't know now, but this is something I'm going to figure out. I kept hearing that over and over and over again. And I kept thinking, we should be putting out the smoke rather than waiting until there's a fire. Holistic medicine, as soon as there's smoke, Holistic medicine deals with that, whether you're talking Chinese medicine, nutritionist, Ayurvedic, some of these other energy modalities. There's so many ways of addressing an initial issue that someone notices rather than waiting until this disease has ravaged the individual. Second example, when you go to see 3 different specialists in Western or conventional medicine, you may get 3 different completely completely different diagnoses. Let's say you've got a skin issue. Dermatologist is going to diagnose your skin issue. The skin issue, for them, depending on what questions they ask, dermatologists tend to be pretty good, may be related to something else that is systemic, another organ issue. So let's say you see a cardiologist, a heart doctor. That heart doctor, the cardiologist, is going to give you a diagnosis that has to do with your heart. May completely ignore what's happening with some of these skin lesions that you're having. You see a third doctor. Let's say it's a gastroenterologist, someone who deals with stomach, small intestine, colon. They will give you a diagnosis that has to do with the GI system, the gastrointestinal system. But they might not comment on what's happening with the skin lesion and what's happening with your heart because other specialists have dealt with that. So what ends up happening is conventional medicine, the way that it's structured, it has broken the body down into either parts or organ systems. It's not looking at you as a whole person, okay? Holistic medicine is looking at you as a whole person. So that skin lesion or condition, the thing that's going on with your heart, what's happening with your digestion, that are all clues. All of those are clues to help make a more accurate diagnosis for what is going on in your entire body and your brain. Okay? Again, conventional medicine, the brain is separate. It's like the brain is separate from the body. The mouth is separate from the body. That's not how you are designed. So again, holistic medicine is giving you an entire diagnosis. It's looking at you as an individual, what you are experiencing, and also what might be affecting your experience, how you live, how you eat, your relationships, what kind of stress you're under, what your job is, what your activities are. Do you have activities? Are you exercising? There's so much more that goes into looking at you holistically than just checking some box and making sure that you fit within a box. Last thing. Now, this can actually count for both holistic and conventional. But I'm going to say overwhelmingly, in conventional medicine, you have arrogance and you have greed. And the arrogance and the greed can override judgment. This is a huge topic. I've seen this from the very beginning of medical school all the way through. And it's impacted me in such a way because I just don't like dealing with that kind of bullshit. I can't stand it. I would have thought, and I was naive, I was the first person in my family to go to medical school. One of the few to finish college. And I think when I finished, I think I was the first one. may have been the first one, maybe the second or third, but I think I was the first one to finish a 4-year degree. And what I've seen consistently in conventional medicine, I've also seen it in holistic medicine. Holistic medicine is a little bit different, because in holistic medicine, you get these woo-woo people, you get people who are charlatans, you get people that are basically selling crap to make a quick buck, or they are taking advantage of scared people. I really don't like that. But in conventional medicine, you get some of these just arrogant and greedy folks. And I think what has happened since we had a certain virus about 5 years ago, that most people have waken up. They have seen that there's profits over people when it comes to the conventional medical system. That the conventional medical system does not have your best interest in mind. What it has is trying to extract, trying to take as much money from you as possible, maintaining the disease that you have because it's profitable, and just dealing with symptoms. So I'm actually being kind of light right now. I've got way more to say about this. And I think this will be the beginning of a series where I compare and I contrast. And I do have good things to say about conventional medicine, because it can save your life. But once your life is saved, you got to stay away from it. You need someone who thinks holistically. You need someone who's going to help you get back to your normal state, your healthy state. And unfortunately, conventional medicine does not do that. Holistic medicine does. Now, I'm biased towards Chinese medicine. I'm biased towards Ayurvedic medicine. I'm biased towards the more Eastern aspects of medicine. I'm also biased towards nutrition, because the way that I learned was everything begins and ends with your nutrition and your digestion. Everything begins and ends with your nutrition and your digestion. So I think that's good for today. Please put a comment in, because like I said, I've got a lot of experience with both. I believe the best medicine involves all aspects of medicine. I think we need to take the best that all medicines have to offer and combine them in order to help you be the best that you can be, and to avoid these side effects, and to avoid some of the expenses and some of the snake oil that's out there. Part of what I think that we can do is we can actually prove what the best medicine is. So I'll leave it there. Thank you for listening. Please comment. I want you to like and subscribe, and share this video. Share this video with people you know that are doctors, that are nurses, that are acupuncturists, chiropractors, nutritionists, who are doctors of physical therapy, athletic trainers, because we're at a critical point right now where conventional medicine is failing us, particularly with chronic disease. We keep spending more and more money, and we're not getting results, and so we have to start doing things differently. All right, thanks, bye-bye.